The heart contains 4 valves: mitral, tricuspid, aortic, and pulmonary, each ensuring unidirectional blood flow. During heart contraction, these valves open and close in coordination to efficiently pump blood to the lungs and body. Proper valve function is essential for maintaining healthy circulation and preventing blood backflow. Heart valve diseases manifest as either stenosis, where the valve narrows, or regurgitation, where the valve leaks. Stenosis restricts blood flow, while regurgitation allows blood to flow backward. Valve diseases can arise from congenital defects, infections, age-related degeneration, or other heart conditions. Untreated heart valve diseases can lead to serious complications, including heart failure, arrhythmias, and increased risk of stroke. Treatment options range from medication to manage symptoms, to surgical interventions such as valve repair or replacement. Advances in medical technology have significantly improved the outcomes for patients with heart valve diseases, emphasizing early diagnosis and intervention.